Hi everyone, my name is Selena Belisle and I am the founder and one of the board approved CE providers and instructors teaching massage and bodywork here at CE Institute. If you want to see more of this training presentation or obtain more training with us, it's available at our school website, which is ceinstitute.com. What I'm about to share with you is part of a larger course in sanitation and germs and protection for massage therapists, how to properly sanitize their workplace and learn more about pathogens and airborne virus and things that can be harmful to us. So we put together this training unit. This unit is part of a larger unit in how to properly clean, disinfect, and sanitize in a massage work setting. If you want to see the entire training that includes some of this unit, this is part of our 5 CE germ sanitation and contagious and infectious disease training that's available at our school. The information that I'm going to share with you right now for our sanitation training has been published in Massage Magazine. So if you'd like to see all this information in full, you can visit massagemag.com, and in the search bar, just search Contact Time or My Name's Selena, and you'll be able to see this published article. We've also provided the same information from the article in your student workbook for this training, which you can download as part of your student files. First, I'll define what the difference is between cleaning, disinfecting, and sanitizing. Cleaning is the process of removing germs, dirt, and impurities, physical debris from surface or objects, and that's achieved by using soap and water to scrub and then rinsing with water and physically wiping away with maybe a cloth or a sponge. Disinfecting is different than cleaning, okay? Disinfection generally uses chemicals to kill germs on surfaces and objects. But in order for disinfection to be effective, those surfaces or objects must be cleaned first, because if there's physical debris on the object, then if you just spray like Lysol or something over it, it's not going to work. So let's use for the example of somebody is in a face cradle cover and they had makeup on, and for whatever reason the cover over the cushion, the face cradle, wasn't effective and the makeup is all on your upholstery now. You need to physically wash that makeup off the upholstery, because if you simply spray a disinfectant or wipe over it without physically moving, washing, and cleaning away that makeup, your disinfection processes will not be effective. Lysol is a perfect example of a disinfectant. It's a chemical that's sprayed, and they also make claims such as it will kill 99.9% of viruses and bacteria. Be careful of those claims. There's special disclaimers with that, and that is you need to employ contact time with these disinfectants in order for them to be that 99.9% effective. The term sanitize or sanitation is when we use a method to lower the number of germs on surfaces or objects by either cleaning or disinfecting. And that's to lower the risk of infection with harmful bacteria and viruses and so forth. So sanitation is using cleaning, disinfection, or both. That's how you sanitize. So you might be thinking to yourself right now, oh my goodness, I have to clean and disinfect my massage equipment between appointments? Generally, the answer is no. If a person is left behind makeup or physical debris on your massage equipment, then yes, you do need to wash it with soap, water, rinse, wipe away that physical debris, and then you would apply your disinfectant. Usually cleaning cleaning by itself lowers the number of germs to an acceptable sanitary level. They say cleaning can lower germs by like 70 to 96% just with soap and water and rinsing and wiping away. And then disinfection, when you're applying a disinfectant, as long as you've employed proper contact times, you can get like 99.9% of germs and bacteria destroyed. But when it comes to your massage equipment, what's acceptable sanitation? Usually just applying a disinfectant such as a Lysol or Clorox wipe or even a spray with a paper towel, making sure that the surface stays wet with a decent, adequate amount of contact time, maybe not the full contact time, but that's usually okay. So again, when it comes to your massage equipment, the face cushion, the chair, the table, the bolster, whatever you're using, if there is no visible physical debris on your equipment, you can usually just get away with disinfecting it, applying a disinfectant. If there is physical debris, wash it away first. That's usually good enough, but if you want to provide thorough and extremely thorough sanitation measures, let's say you're working in oncology, where you have to eliminate as much bacteria as possible, then you would always clean first and disinfect afterwards. So let's put this into perspective for massage therapy practice. Should we be cleaning, sanitizing, or disinfecting? The answer is all three. When you are practicing and you're booked back-to-back with clients, you simply need to sanitize. Sanitizing is to lower the number of germs to an acceptable amount. Now, there isn't a percentage of germs, and there's no way to measure the percentage of germs in your massage workspace, okay? It's even in doctors' offices, they aren't going around measuring germs. Oh, this is sanitary. So as long as good faith is used, you've either cleaned or used disinfectants or both between your clients. That is sanitizing your treatment area and your treatment equipment and supplies and so forth. So that could include washing with soap and water. If you're using massage cups and there's oil on them, you would need to physically remove the oil from the cups by washing them before applying a disinfectant over the cups, which could create greater sanitation when you apply that disinfectant. That would probably be the greatest sanitation of all, because you're not going to sterilize plastic cups. So with massage practice, you are always sanitizing between clients. That could mean cleaning your equipment and supplies. It could mean disinfecting, or it could be both. Cleaning alone is acceptable. Disinfectant alone is acceptable when physical debris is not on the product. You can just spray over it, and you're spraying the actual surface area that comes in contact with the client. And of course, both cleaning and disinfecting together is the best sanitation of all. That will likely eliminate 99.9% of germs, harmful bacteria, and so forth, as long as you employ proper contact time. Now, there's something called contact time, which is also known as dwell time, that's used with disinfectants. That time is the amount that you will leave a disinfectant on a surface or an object. And when I say leave it on the surface must remain wet with the disinfectant for that period of time. So most sanitizers or disinfectants, so right now I'm going to review a bunch of disinfectant products with you, so that you can better learn about the contact time, which is also called dwell time. It's the same meaning. It's just interchangeable words here. And I want to show you 3 different Lysol products because believe it or not, even when it's the same name brand, and even when it's a similar product, like these Lysol wipes versus these Lysol wipes, they have different dwell times. Go figure. They're both Lysol wipes. Why would they have different contact times? I don't know. I'm not going to contact the manufacturer and ask, but they are different. And what's interesting with Lysol, is they say to sanitize. Now we know that sanitation is simply lowering the number of germs or harmful bacteria and virus on a product or surface, on a piece of equipment, what have you. And here it says to sanitize, you merely need to wipe and allow the surface to remain wet for 10 seconds. Okay, wow, that's quick, 10 seconds, great. But it says to disinfect, and the disinfection is usually to kill that 99.9% of harmful germs and bacteria and virus. It says they want you to allow the dwell time, allow the surface to remain visibly wet for 4 minutes. And what's interesting is you look at these Lysol wipes, they're both Lysol wipes. These Lysol wipes say that they want the surface that says wipe hard, non-porous surface with wipe until surface is visibly wet. Allow surface to remain wet for 10 minutes. So to disinfect with these wipes, it's a 10-minute contact time. And to disinfect with these wipes, it's 4 minutes. Go figure. Now remember, to sanitize with these wipes, the surface only needs to remain wet for 20 seconds. Okay, so, and with this mixture, this is mixed with water, probably distilled water would be best. This one allows you, or wants you to allow the surface to remain wet for 60 seconds. So we have 3 different Lysol products here. This solution that's mixed with water, whenever you're disinfecting the surface or object, needs to remain wet for 60 seconds. To sanitize with these wipes, it just needs to be 20 seconds. And to disinfect, to kill 99.9% of bacteria, it needs to be 4 minutes. And with these wipes, your contact time, same manufacturers, Lysol wipes, they're saying with these wipes, they want the contact time to be 10 minutes. So the moral of the story is when you're using disinfectants to sanitize your massage equipment and supplies, make sure that you're reading the contact time, because each product might be different, even when it seems to be like the same product. If it's not the exact same, you do need to read the contact time. Let me give you a couple more examples. Here's some Clorox disinfecting wipes. I like these flat packages. They're easy to travel with for sporting events and chair events and so forth when you're doing on-site services. These wipes are 4 minutes of contact time, while a package that's identical to it, a different brand, these Lysol wipes, are 10 minutes. So go figure. Also, sprays. Here's a sanitizing spray. I've never seen anything like this, but it says it will sanitize in 20 seconds. So it kills 99% of germs and bacteria in 20 seconds. Wow, I don't know if that claim would be true. It doesn't sound like it would. This is another disinfectant spray, and this one says it's going to sanitize in 10 minutes. So, just because it's a spray, you could have anywhere from 20 seconds to 10 minutes or longer dwell time, contact time, where the surface must remain wet with a disinfectant to be effective. Disinfection is considered to be less effective when proper contact times are not observed. So it's not considered ineffective, it's less effective. So when you spray with one of these sprays, even if both of these required 4 minutes contact time, even if the spray is left on for 20 seconds where it's visibly wet, you are going to have some type of sanitizing effect. It might not kill 99.9% of germs in 10 seconds or less, but it's probably going to kill and eliminate quite a bit of germs and create a sanitary action. Now, contact times require a sufficient amount of disinfectant to be effective. And if you read like some of these spray bottles, it'll say spray 6 inches from object. That's because it's kind of looking for a immersion of fluid of chemical disinfectant on whatever you're trying to sanitize. Okay, so let's say that you're sanitizing a chair and the upholstery becomes dry before the contact time is over. And you're trying to really disinfect this chair because you know the next client has no immunity. They might have had a stem cell transplant, or they're missing their spleen, or what have you. They're a geriatric, they have very poor immunity, and you want to do a really good job sanitizing and disinfecting the equipment. So if your upholstery dries or your equipment dries before the contact time is up, simply reapply your disinfectant. It's really that simple. The contact time has to be 4 minutes or 10 minutes or whatever it is on your product label. It has to stay wet for that amount of time. You can reapply 6 times if you need to. As long as it remains wet for the amount of time that's listed on the label, you will achieve your contact time and the disinfection that's advertised on the label. So to be perfectly clear, when you have a product that says it's going to kill 99.9% of viruses and bacteria, you must observe the contact time, and that means the surface or object must remain wet with the disinfectant that entire contact time to achieve that advertised result. And remember that contact times can last as little as 20 seconds or as much as 10 minutes or more. Every product might have a different contact time. Now, in order for product manufacturers to sell products that have these claims, kills 99.9% of bacteria and so forth, it needs to actually be approved by the EPA for efficacy. Tests need to be shown and proven to support the claims that are being made on these product labels that you find on products in stores and so forth. The government regulates this. So it's really important to read those labels. There's a whole government process to ensure you are achieving proper sanitation with these products that you purchase in the marketplace. And I attended, I forget if it was an EPA or OSHA training once in sanitation, and it was really interesting. I'll never forget the instructors saying this. They said, the label is the law. And that's like literal. That label was government processed to show in testing that the contact time with that product, as long as it remains wet, it will achieve its advertised result. So the label, the instructions on that label, that's the law. That's what we should be following. So let's take this information and apply it in real time to our massage equipment and supplies and the different sanitation methods and mediums that can be used. Your disinfectant wipes are usually the handiest product that you can acquire to disinfect or sanitize massage equipment. And remember, the equipment should not be porous to achieve disinfection. You're not going to truly achieve that 99% killing bacteria and viruses if you're working with a porous object. So your upholstery, that's porous. You're going to get some disinfection on that, but it won't be 99.9% free of germs and bacteria, because the porous, the disinfectant that doesn't leak into the pores of the upholstery, that still could have some harmful germs and bacteria. But believe me, applying enough of this and observing the contact time, I'm quite confident you'll kill enough germs and bacteria to have an extremely sanitary practice. When you're sanitizing things such as massage stones or massage cups for cupping, those you might want to do a soak, and of course cleaning, washing, wiping with water and so forth, and rinsing. That is going to be more effective with objects. So with your wipes, I think it's great for your massage chairs, tables, bolsters, and so forth. Those are great. Just know that your wipes might not be the most appropriate to disinfect or sanitize with all of your massage equipment. Your disinfectant sprays might be better for something that's more porous. If you do not have access to water and soap and rinsing and so forth. So sprays can also be used on your massage tables and chairs and the cushions and bolsters and so forth. You can also spray some of your equipment, such as hot stone equipment or cups and so forth. I think spraying is a nice add-on after either cleaning or wiping with a disinfectant. I usually do not spray things alone unless I'm leaving the office for the night or packing up a go bag or something. And then I might spray like the doorknobs, light switches, table pegs on the table, things that are clean. I'll spray afterwards to disinfect to create a really good sanitary practice. Now, soaking items in bleach is another example of where you can disinfect. And usually on the bleach label, it will say how much the bleach should be mixed with perhaps water. You usually do not use bleach straight out of the bottle. And it'll usually tell you how long that contact time should be in the immersion soak that they've recommended to mix between the bleach and the water. Now, if you have glass items would be appropriate for a bleach soak solution. But if you're sanitizing things like stones or plastic cups, I don't recommend those in bleach. The stones, yeah, I mean, it's going to help kill a lot of bacteria and harmful germs and so forth, but I think stones are energetical properties, and I don't want to bleach them. I think that's destroying their energetical properties. And as far as cups for, cupping massage and so forth, if you're going to put plastic cups in a bleach solution, first of all, you're going to destroy the rubber sealants with the bleach, and also the plastic usually cracks in bleach and it deteriorates in bleach. So bleach is great for non-porous objects such as glass. And if you were using glass cups with fire cupping, which usually isn't within the scope of massage therapy, but that would be a perfect example of where a bleach soak would be appropriate. You can also, let's say that you had somebody with contagious disease in your office, you can take like the face cradle holder, if it's one of those hard plastic ones, and the table pegs, the screw pegs on your portable tables, you can put those in a bleach soak for, a one-time immersion just to try and kill bacteria and so forth. But those are examples of when you could use a bleach soak solution in a massage practice. Now, when you're using hand sanitizer, I've seen a lot of people use this improperly. And that's because some people, they don't want to dry out their hands by using a lot of hand sanitizer, right? But usually your hands need to remain wet with about a 70% alcohol solution hand sanitizer for at least 20 seconds after application. And I like to keep them wet with friction as well as the 20 seconds. Usually you wouldn't call that contact or dwell time, but I'm going to use that right now for your hand sanitizer. You should have at least 20 seconds where your hands remain visibly wet when you're applying hand sanitizer to try and eliminate the harmful bacteria and virus on your hands. If you just use a pea size of hand sanitizer, which a lot of people did at the start of COVID because you couldn't get any hand sanitizer, it was sold out everywhere, right? That's not really effective. I mean, it's better than nothing, but you probably have loads of bacteria on your hands, and if you haven't used a healthy amount of hand sanitizer and allowed your hands to remain wet for at least 20 seconds with the hand sanitizer. So in conclusion, let's review what true sanitation is. I've just reviewed multiple sanitary products with you that could have contact times between 20 seconds to over 10 minutes. Okay, proper sanitation, which includes disinfection, is not achieved when the product's contact time is not provided. The biggest mistake that I see with sanitation practices and massage therapy trades today is the therapists that do not know what contact times are and they're not observing them. What happens is you'll see somebody spray or wipe a disinfectant on a piece of massage equipment or a surface area, and then they'll immediately wipe it dry. I don't just see this in massage practice, I've seen this in doctors' offices. And I'm like, what are you thinking? You just destroyed your entire, practice of trying to sanitize something. It's interesting watching the doctor's offices that have the intake on the iPads these days. And they're like, oh, we're going to sanitize it between clients. And you're touching it, which your hands are the dirtiest surface in your body, usually alongside of with your mouth, right? Filled with bacteria. And so I've seen receptionists, they'll take their little wipe, they'll wipe the surface of the iPad, and then they'll dry it immediately. It's like you're not sanitizing anything doing that. The surfaces must remain wet. So don't feel tempted to wipe off your disinfectant immediately after applying it. You should allow it to remain wet as long as possible until that contact time is achieved. Sanitation is not something that can be rushed, which is unfortunate because usually in massage practices, we have very little time scheduled for sanitation practices. So it's good to have an educated sanitation practice of knowing what contact time is and then seeking out products that have as short of a contact time as possible so that you can properly and effectively sanitize your equipment and supplies between clients. So proper sanitation steps and practices are: to properly sanitize a surface, first it must be clean. There should not be any physical debris on it. If you don't see physical debris, then you usually do not have to clean it first, but everything has to be clean prior to attempting to disinfect with a chemical. Disinfection is not effective on dirty surfaces. To clean, you're going to wash with soap and water, rinse with water, and then wipe away. After you wipe with cleaning with a sponge, and usually sponges aren't great, I prefer cleaning with things like disposable paper towels and so forth. You can allow the surface or object to air dry, or you can wipe away the rinse water before applying your disinfectant with contact time. We do a lot of sanitation training here at CE Institute, and so we've had to do a lot of research to provide this training for the massage therapist and their establishments. And in reviewing sanitation and proper practices for janitors, one of the top injuries in their field for workman comp claims are chemical injuries and burns. Okay, so be very careful when you are applying your sanitary practices. If you're going to use a disinfectant that has a really short contact time, the chemical might be stronger in that. So there's a lot of negative health side effects when using chemical agents. Make sure you protect yourself. Burns to your eyes and skin are common injuries when applying sanitation practices, followed closely by breathing, inhaling too much toxin. So that's one of the reasons why wipes are usually preferred over sprays, because sprays, you have a lot more of a chance of a nasopharyngeal injury or exposure when you're spraying an aerosol. I'm showing real chemical products here, right? But even natural products can have negative effects on your health. Different natural ingredients such as pine, lemon, citrus oils, and so forth, they usually include, they have something called terpenes in them. And what might help with the sanitation process might be harmful to your health. So even if it's a natural product, just know that, even something that's too much of anything could be harmful. And in the case of natural things like citrus and pine, and even tea tree oils and so forth, anything with terpenes and other skin irritants, all of these can be harmful. So, what you need to do during your sanitation practices is try to protect yourself. When if you're doing like heavy duty wiping the room down from top to bottom, which you might do once a day, not necessarily in between clients, but when you're doing your heavy duty cleaning and sanitizing, make sure all the windows and doors are open. And wear facial coverings and even gloves, especially if you're immersing your hands in a bleach soak. You don't want to put your bare hand as a massage therapist into a soak immersion with bleach. Okay, facial coverings protecting your nasopharyngeal air passage, mouth and nose, even goggles or glasses. All of these would be acceptable when being exposed to excessive cleaning products. You want to protect your airway, your eyes, anything that could be irritated by chemical. That includes wearing gloves and not touching the actual chemical itself when you're cleaning or disinfecting. We do recommend alternating face cushions, and we say this repeatedly. Repetition is the mother of all education, right? When you sanitize one face cushion, you might want to put it aside so it has a proper amount of contact time and just use a whole nother cushion with your client. Have two cushions for each massage table or chair. And when you can alternate like this, you know that any exhaled contaminants from the client that are on that cushion in the upholstery are likely dead after the product has been properly disinfected with a disinfectant and the contact time has been observed. So when you have wiped your upholstery of the face cushion, put it aside and allow it to remain wet for the entire contact time. You might have already started your service with the next client. You look if it's wet. If it's not wet, maybe take some spray or something and spray it down and make sure it has a good contact time to destroy all the harmful germs. On a final note, it only takes a few seconds to read and practice these various uses with your sanitation and disinfectant products. But reading those instructions would make the difference on whether or not you're properly sanitizing or leaving your practice exposed to germs. So remember, the label is the law. You know what contact time is. Observe the contact time to the best of your ability based on how your practice is scheduled. Maybe talk to your employer if you're not getting enough time to properly sanitize between clients to ensure you can get that time. And make sure you are applying appropriate sanitation measures so that people are happy and healthy when they leave your practice. This is where I'm going to conclude our sanitation training in the workplace setting for massage therapists and body workers. Remember, we do have greater training than this. It's available at our school. You can access our home study anytime you wish. When you purchase a course, we send you an email and it's available 24 hours a day, 7 days a week until your course access expires if you want to continue your training. Our website is CE as in continuing education, so ceinstitute.com. And also keep in mind, as a continuing education provider, we're generally training to people who have already completed rudimentary education. So that's for people who are graduates of massage school, nursing school, cosmetology school, PT, OT school, and so forth. We are building upon what you should already know from your rudimentary training as a continuing education course. So we hope you enjoyed, and we hope to see you in another training soon.